Sports injuries, like all injuries, create setbacks that keep us from doing the things that we want and need to do. My name is Dr. Robles. In this video, I'm going to share with you 5 tips that will help you get back into the game faster. Remember, this advice doesn't replace your doctor or your need for evaluation, so be smart. If you have a fracture, dislocation, a tear in muscles or ligaments, or any other condition which makes movement unsafe, do not move the injured area and consult with me if you're my patient or your local doctor for help. Sports injury recovery tip number 1. You need to rest. The hardest thing for any athlete to do is to take time off. So here are some guidelines to help you understand how to make sure you're really resting. If you injured a weight-bearing area, like your hip, ankle, or knee, stay off it at least as much as possible until your pain allows you to bear stationary or standing weight equally. If it's a non-weight-bearing area, like your hands, elbow, or arms, etc., don't use it if it causes pain in your normal range of motion, at least as much as possible. Instead, start with passive range of motion movements first. Then when you're ready to begin exercising, and this applies to whether it's a weight-bearing joint or non-weight-bearing joint, as you begin to push it, use common sense and start small. 10 to 15% of what you would normally do as far as activity, weight, range of motion, or duration. If it increases your pain, then stop. Wait another day and then try it again. Let the principle aim small, miss small guide you. This will let your rest guide your recovery. That doesn't mean don't exercise. Just stay away from unstable, painful, or weight-bearing exercise until you begin to recover. Number 2. If the structure supports movement, then move it. If you have a fracture, dislocation, a tear in muscles or ligaments, or any other condition which makes movement unsafe, do not move the area until it's recovered. However, once it's healed or been repaired, then move it responsibly. Movement feeds the mechanoreceptors that help your nervous system inhibit pain. It also helps prevent adhesions, which can limit range of motion in the future. Number 3, heat. Heat helps improve circulation. Only ice it for pain reduction. Heat will help increase blood flow, nervous system function, and lymph movement. All of these things bring in the necessary components to fix problems and also help to move out the waste products from the damage. Number 4, put in the work to recover. Physical work related to rehabilitation exercises and progressing into sport-specific recovery exercises can take time. What you fill your body with during this time is also important. Your recovery depends upon your dedication to putting in the work that it takes to provide what your body needs both neurologically and metabolically, or in other words, joint biomechanics and how you turn what you eat and drink into energy. Number 5, if you're not able to recover quicker in between exercises as you proceed with the rehab program, or if you're not able to consistently improve without setbacks, you need to evaluate why. That's where my work comes into play. Strength is one aspect of function. However, response rate is a better measure of muscle performance in athletes. Rehab and strengthening of an injured joint is an important step. However, it's not in the best interest of the athlete to ignore the response rate and patterns of dysfunction in their muscles individually or as a kinetic group. Dysfunction in the body, both at the site of injury and in some cases in areas that seem unrelated, can have a direct influence on the recovery time, as well as your ability to return to athletic activities sooner. Patterns of muscle dysfunction in the joints above or below, which are part of the kinetic chain of movement, may impact function of the injured joint. Therefore, evaluation of the response rate of muscles involved in the movement patterns for strength building exercises, that should occur prior to increasing the intensity of those exercises. In some cases, often when the injury is severe, it should occur before any exercise programs begin. A rule of thumb for determining whether your injury is severe would be to consider anything that cannot be exercised for at least a week due to severe pain, structural damage like fractures, dislocations, severe sprains or strains, or instability. This will help limit the potential of doing the exercises inappropriately and injuring other parts of your body, which may delay healing, lengthen rehab exercise programs, or limit results. Visit my website, lucidforce.com, and click on the sports injury link in the menu to learn more about this exciting treatment that many professional and amateur athletes are using to prevent injuries and stay on top of their game. If you live in Southern California, we can help. We're located in the city of Upland, and we're within an hour of Los Angeles or Orange County cities. So if you have an injury, are prone to re-injury, or want to set yourself up to prevent future injuries, you can visit us online or check out the description for our contact information. You can also check out my video about the metabolic component of healing sports injuries as well. Don't forget to like and subscribe to my channel for more great health information. Thank you for your time. I'm Dr. Richard L. Robles, and I hope this information helps you get on your path to health.